So welcome to this Euronews event. Welcome everyone. Also those joining us from our stream online. So competitiveness is a buzzword in Brussels. Don't worry, I'm not gonna ask if you read the Draghi report. Don't worry, but it's a nice word. It means a lot of stuff. But today we're gonna be learn whether health can be the winning area also when it comes to competitiveness. Of course, if Europe can take the lead. We know that the pandemic brought a lot of a new impetus on health. We're now back to the normal. Together we will explore in this event the state of play of the European healthcare investment and also the essential elements of a smarter strategy, the cost of inaction when it comes to health investment for sure. So we're also trying to dig a bit into what happens if Europe slows down and health spending is a bit deprioritized. There are also some big policy events ahead us. For instance, the Biotech Act, but also the long-term budget. So I have very distinguished guests here with me to talk about this. We start with Stina Bosse from the European Parliament. She's a liberal lawmaker for Renew Europe. Thanks, Stina, for being with us. Then I move to Chris Sterkens is the group company chairman for EMEA at Johnson & Johnson Innovative Medicines. Thanks, Chris. And then Calypso Calkidu, Director of Health, Finance and Economies at the World Health Organization. Thanks, Calypso. And Professor Dennis Oswald, who's the founder and CEO of the WIFOR Institute, very renowned institute when it comes to also the economic impact and so on. We're gonna start with Stine, though, because she has a very busy, lawmakers have a very busy agenda, but she had a last-minute last-minute group meeting related to budget, if I'm not, because you're also shadow on the budget.
Exactly.
So you're gonna put health high in the
That's why I need to be there.
Of course. Of course.
Yeah.
So yeah, lupus in fabula. So Stine, I want to start with you to take advantage of your expertise and to bring the political perspective in the debate. You also said many times that health can and should be the Europe's winning area over the next decade. We know that on other topics, digital and defense, will be lagging behind. So what will it take to make this happen?
Well, first of all, I think it is important to realize that there are areas where we are definitely lacking and where it would take, whatever effort, we would probably never get it. But in the health area, with large pharmaceutical businesses and with a very, very strong public health care sector, that combination is exactly the right combination that could turn us into the most competitive, cleverest area in the world, but also the place in the world where that position would of course trickle down and make sure that we continue to be the place where our citizens have the best health and the best healthcare systems. So for me, these things go hand in hand. They're not each other's enemies, they're each other's friends, and we have to have a dual ambition.
And do you think there are also some area specifically where this competitive edge of Europe can be proven, like for instance rare disease or AMR, or also there's the opportunity of cross-border trials as well? What's your take on this?
Well, we are busy on those two subjects that you just mentioned, because rare diseases right now, I'm not sure that we have the strongest position, but we could have, and we should have. And rare diseases are only rare if you look at them country by country. If we look at them together, it's 36 million people. Come on, why are we hesitating? And we are getting somewhere in this area, but we could do much more together. We could be much more ambitious. and we could get many more countries to join in. And I want to quote our Commissioner for Budget. He said, now this is a couple of months back, it was before he showed us the MFF ideas.
I don't think he changed his mind on this.
Okay, but he did say this, and I will keep him, really accountable on this quote. Everything we can do better and cheaper together, we must. And there are some areas, not only AMR and rare diseases, but many other areas where we can actually do so much more. And I'm not talking about moving responsibilities between nations and the European Union. I'm only talking about solutions for patients. And, of course, conditions for the pharmaceutical industries to make sure that this can actually happen. So for me, that is my passion, and that is what I want to really make an effort to make sure this happens.
So you're gonna bring it up next time you see Seraphine in a hearing.
I did already.
Yeah. Okay.
I did several times.
If Commissioner is watching us, what are you gonna tell him?
I'm going to tell him that I still reckon him as one of the best commissioners for budgets that we've had for a long time, and that exactly that thinking has to trickle down in the way that we design our budgets and our MFF. If we don't do this, we're leaving too much space for the Oval Room, fast and quick decisions, let's just go, or the other rooms, I won't name them, but you know who I'm thinking of, a couple of rooms at least, very fast decisions, let's just get going. We've got to make our act work much better together. And that's not leaving anybody aside, not any country, not any citizen. It's actually paying attention to what we really need in Europe today.
I'm just going to exploit you for another question and then having a quick tour with the others so they can actually comment on what you said. But let's be frank. What happens if we don't act? Like, what are the risks of standing still when it comes to health investment?
Look, if anybody in the room thinks it's a brilliant idea that we are lacking behind in the digital developments, if anybody, please raise your hand. Just say this is a fantastic situation for Europe. No.
Please do it in case.
So, no hands raised, right? It is pretty devastating. If we are honest, it is not good. We would be idiots if we risked this to happen for our pharmaceutical and healthcare sectors, I would call it, because they work together hand in hand. It would be horrible, and it would be a disaster, I think, for politicians around nowadays to look back 10, 20 years from now and say, oh, this is terrible. We really didn't get our act together. We didn't really get it going. So let's please make sure that this time we get it right. Even if we have to be, I mean, it's 25 years it's been on its way, isn't it? The framework that we're sitting with now. So we've got to get it right now during the next 5-6 months to make sure that the
You're
pharma
also
package.
shadow on this, yeah.
I'm also shadow on the pharma package. Yes. Let's get that right. Let's get the Biotech Act right. Let's get the Critical Medicines Act all together. Pieces of a very important puzzle. Let's get it right.
For those who are watching, no one raised the hands in the room. Just quickly, Calypso, you have any comment on what Stine raised, particularly on the EU action, on the EU side? What's the perspective on from the WHO on this?
Well, thank you for the opportunity, and thank you for the leadership. I think as you were speaking, I was thinking about how important the EU leading by example is currently in the global ecosystem. We're seeing countries, developing nations, actually deprioritizing health in budgets, and that's devastating after COVID, after what we've seen. And I think being able to have that communication, to reach out, and through the Global Gateway as well, the health policy arm of the Gateway, to communicate those arguments, to empower policymakers to make the case internally for domestic financing. And then I was also thinking Europe as a financier through the European Investment Bank, for example, the potential there for underwriting, for leveraging, for crowding in investment in health in emerging markets and emerging economies. So I think the potential is huge, and I hope through this conversation and beyond we get to it.
Dennis, I'll be back to you in a second. Just want to give the floor to Chris. Since we have our lawmakers in this room, what's the main ask from the industry side?
Well, I think it's quite simple. You need to look at health not as a cost, but as an investment. And if you actually look back at the 90s, when things were not as constrained as now, and you see how the economy flourished and let's say the scientific progressions and the consequences of that. I mean, you turned HIV into a chronic disease, you cure Hep C. On average, most cancers now have more than 5 years of survival. All of that prosperity that you get by having better health leads to more economic prosperity. And as such, obviously, if you look at it as an investment, the returns for that are going to be clearly to be demonstrated. And that's the challenge that we have. I think we often look at it short-sighted. Governments change every 4 years, have short-term agendas. Sometimes they work on cash budgets for just 1 year. So what we lack, at least at the national levels, is a European vision in saying, look, let's look at it for the long term and let's see what we can do. And you'll see, and you'll hear Professor Oswald talk, it's a smart investment to do.
Yes.
You have to go.
I have to go.
Okay. Come back victorious in your
I will
eyes.
I will do whatever it takes.
You think galvanized after this?
And thank you very much for the invitation.
Okay.
And sorry that I have to leave you now, but I'll do my best. Thank you very much.
Thank you, Stina. Thank you. So yeah, Dennis, you have this big task ahead. Also, Chris was basically setting the ground for your intervention. Can you bring some evidence about the societal and economic value of health investment? Chris just mentioned this aspect.
Thank you for having me. The title is The Value of Investing in Healthcare, right? We need to describe the value much broader. Because in most of the cases, if you talk to politicians, in the end, they think about health as a cost. It's always a cost. But it's not the truth. You need to see the entire investment in Europe in health creates 30 million jobs. As much as the entire the working power of France. It creates 1/10 of the wealth. Only the investments in health, this is the value. But this is just an economic value. And so, but it's the biggest sector, the healthcare sector is the biggest sector, economic sector in Europe. And I'm proud that the German new chancellor announced it a couple of weeks ago, and he said, we did a mistake in the last decades because healthcare is not a cost, but it's the fastest growing sector in Germany. And I would say it's also the fastest growing sector in Europe. And it's the beauty in this sector is, it's not only in the economic sector, it creates better health. And better health creates more productivity. More productivity means more growth, more GDP, more fiscal space. So we can think about a positive feedback loop, and this is the value. And this is only the macroeconomic point of view. And there are also some risks if we don't invest in health. Because we can afford the healthcare systems today, but I'm scared about financing them in 10 or 15 years in such an aging society as Europe.
Yeah.
One thing that I'm always being curious about is there's been much talking about green financing, for instance, and when we talk about health financing, sometimes it's a bit more complicated to talk to the right person, policymakers and so on. So what do you think is that, and this is also a question that I'm going to turn into a follow-up to others. So this thing that we also mentioned defense before, there's always a sense of urgency or a sense of something outside of the health realm is a bit better to invest in. What do you think it's so?
So first of all, we need to learn, if we're talking about financing, also from other areas, right? Even though also the healthcare sector need to learn from other sectors concerning digitalization and so on and so on. And I ask always my question is, why is it so easy to finance green transformation and we don't even think about a health transformation? It's a huge amount, and the answer is political will. If you talk about health, you won't find the political will to finance it. Because we don't find we have arguments at hand, but we are not addressing the right stakeholders. We are talking within our bubble, and we are all convinced. If you are working in the healthcare system and you say, yeah, health is an investment, but talk to ministers of finance and try to find arguments that they see health as investment. That's a challenge and an opportunity.
So some good food for thought for later on. I'm sure we're gonna come back on that. Just quickly from Calypso and also from Chris on a comment on this lack of political will from the perspective of the industry and from an organization like the WHO. Do you agree on this?
Well, I don't know if it's a lack of political will. I think it is often has to do with a sense of urgency. I mean, why, for example, is all of this focus about spending a percentage of GDP on defense? Because there's an acute situation. Why we were able to really rally for the pandemic and get a vaccine out? Because there was an emergency. And so I think they underestimated the cost of inaction. But let me also take it a little broader, because your initial question was, is health a winning, should it be a winning, let's say, aspect of the EU? And I think it is actually a must-win battle for us, because Europe lost over the last 20, 25 years so much economic ground to the US and to China. And you said in the beginning nobody read the Draghi report, but I actually did. And in that Draghi
He did. We're going to do a test.
In that Draghi report, it actually says, hey, there are some strategic sectors where Europe can make a difference. And health, pharmaceuticals, biotech, digital, and so on are all part of that. And with other industries losing their power, like the German car industry and so on, I think for Europe, this is another opportunity to really double down and see it as the investment that it requires. Also, European citizens in any survey say, hey, health is a top priority. We really should be entitled to get the best health out there. So I don't see any reason. We already said it's strategically, it's a great investment. It's not asking trade-offs like sacrifice something else for health. No, just make sure that health gets its position, because the returns are absolutely there to be rewarded upon. And so I think that makes the case very, very clear for seeing it as a strategic investment and as the key priority that Europe should be putting in focus more.
Calypso, I'm going to take advantage of your broader perspective, because we know that there are currently some pressure on health when it comes to finance, debt, inflation, and also collapsing aid when it comes to development aid. So what's your general take on the current pressure on the health investing?
I think there are significant pressures. As you mentioned, we're seeing a collapse in aid, with aid for health disproportionately affected. Based on our estimates, we'll be looking at something between 35 and 40% reduction in health aid between 2023 and 25. So that shaves off about $10 billion, real dollars. And this is at a time where we've got inflationary pressures, we've got significant debt. Again, emerging markets are really struggling to manage their debt, which has become quite expensive now. So 3.4 billion people live in countries where debt servicing, the governments spend more on servicing their debt than on health or education. So ultimately, it is political will. It's also ability to act in the current context, fiscal space. But I want to say something positive as well in all of this. A few weeks ago, our Director General was invited to Accra for a health sovereignty summit convened by the president of Ghana. A number of other leaders were there. And the commitments made and the reality also, we see, for instance, in Ghana, a 60% increase in the budget allocation to health and national health insurance. So in all of this crisis, I think there's also perhaps an opportunity, it sounds banal, but it's true, to show that political leadership. And going back to the EU, how can the EU help, lead by example, and also support these countries make the right choices?
But, I mean, we are in the heart of the EU policy making. You know that the EU has a role also in shaping the global policy agenda. What's your take on the cooperation between the WHO and the EU when it comes to that?
If I may mention two examples, I think they're quite large examples and could be scaled further. The first is the UHCP Universal Healthcare Coverage Partnership, which is a flagship investment by the EU through WHO. It's the sort of a health policy arm, I would describe it as, of the Global Gateway. And it is about building capacity, strengthening capabilities, supporting health financing reforms, data, governance. It's a sort of the software on top of the hardware that is the investment that the Global Gateway is making, is committing. And that's critically important. 125 countries, really a lot of momentum, and even more important now, and crowding in funding from others, including the UK and foundations as well. So a really good example of how things could work. Creating investment plans, behind which comes financing, and that's the second example, the Health Impact Investment Platform. We launched a couple of years ago with the European Investment Bank. The aim is $1.5 billion towards primary healthcare investment through those strategic plans that are owned by countries, are driven by countries, that crowd in domestic and other concessional and private investments. So I think having the EIB global work together with UHCP through the World Health Organization, our presence in countries, is something that we could scale, and it's what I think the global gateway in health policy could look like.
Even for journalists, it's good to catch up, because in general we tend to cover the hardware part that much, you know, announcement and so on. But as you said, there's a software part that actually is a way to make in practice what has been decided in terms of global policy here in Brussels. I'm back to Dennis, because we mentioned a bit cost of inaction. I also did it. Can you quantify this cost of inaction, or is it too difficult to do?
No, it's possible, and I liked Chris, your comment on urgency, right? And you need to create urgency. You need to have evidence, right? And just an example: cardiovascular diseases in Europe creates today a damage measured in GDP, depending on the assumptions, between 4% to 5% of GDP. I think it's urgent. And now try to forecast it 10 years, and then we stay, because if we don't act, we will have 6-7% of GDP. And now that's why we need to act. But it's also a great opportunity, because if we act, and in cardiovascular diseases, if you talk to physicians and to different stakeholders, there are a lot of opinions that you can save up 20, 30, 40, up to 50% of the events if you act. Just assume that we can reduce this cardiovascular burden by 20% over the next years. We save up 1% of damage in GDP, what means 1% growth. And this means illnesses means recession. Health is growth. And this is why I'm so enthusiastic about this topic. We have such great opportunities. We can, with smart investment, we can create golden decades in Europe, but we need to see health, good health for our societies on the top agenda.
Can I build on that?
Absolutely.
I was giving like the positive news on how we make progress in cancer, and I think it could be misleading, because if you look at it, there's about 20 million cancer cases in 2022, but they are expected to grow to more than 50 million by 2050 if we don't act. and things like depression or burnout are on the rise. We talked about aging population. We ask better healthcare. Diseases to be treated are becoming more complex, and yet budgets for healthcare actually stay flat to GDP. And there's been several longevity studies that if you don't invest more in health, actually by 2050, our life expectancy will actually go down because of all of these factors. So again, to the point that Professor Oswald made, the urgency is there. I think people are just blind to it or are pushing it a little bit away and see maybe conflicting priorities, whereas it's made perfect sense to invest in health also for the generations to come, just to alleviate the burden that is actually coming towards us.
We were talking about the importance of evidence. I mean, Danny said so. But in terms of evidence, when it comes to innovation in health, in medicines, because sometimes I feel that it's a bit like the term competitiveness. That it's a bit everyone knows in the bubble that we were talking about, in our own bubble. But then in terms of practical experience, practical terms, how would you think of innovation in a way to deliver, real world value to patients, to community?
But you would, I mean, first of all, I think there's been several studies done by the WHO, by OECD, that every year in life expectancy that you gain will actually accelerate your GDP growth by 4 to 5%. Now that by itself, this is not about economic models, but if you have a prosperity in economy, you actually recuperate part of the investment through taxation because of the higher productivity. That is one thing. Now, I'll be the first to say that within healthcare, there's a lot of inefficiencies that we also need to address. We need to clean up our own kitchen as well. I think we budget way too much in silos, hospital silos, other silos, and so on, and we don't look at managing diseases as a pathway from end to end. The systems are not set up like that. So the OECD has actually calculated that about 20% spent in healthcare is just not bringing any benefit at all. And then I think we also need to change how we look at how we actually go about diseases. I mean, go from, instead of treatment, go to interception and eventually to prevention. I mean, I think the premise should be you prevent what you can and you treat what you cannot. And I think that mind shift is so important. But here's again a problem. People don't like to pay for something that hasn't happened yet. So for paying for prevention is it's not something that people are immediately convinced of, because you get the benefits later down the road. But it's really, again, by looking at it as an investment, that it's so much worthwhile to do it that way.
I'm seeing Calypso nodding on this. Still on this health as a driver of economic growth. Do you agree with this?
Absolutely.
Need to do things holistically.
Absolutely. And to the point, both points, the point on prevention. If you take health taxes, taxing bads, taxing tobacco, taxing sugary drinks, taxing alcohol, according to the latest analysis, a 50% one-off increase in tax rates in the developing world, the number is even bigger if you go beyond that, would yield about $2.1 trillion US over a period of 5 years. That's roughly a little bit less than 50% of what this government spent on health. So you can imagine the benefit. And the benefit is not just that, it's also preventing diseases that you have to treat, so you're saving. And of course, most importantly, you save people's lives. So I think that's an important policy, certainly underused in emerging markets. And the second point I would make in terms of efficiency, again, developing countries, about $4 per person, especially in the lower income countries, is left on the table. Now imagine countries which spend on average $8 to $9 per person per year on health. $8 to $9. The average for OECD is 5,000-6,000. And as much as half of that is just not spent. So scarce resources budgeted and yet not spent because the systems are not there, procurement systems, the ability for the money to flow through the system, et cetera, et cetera. So huge potential there for improving the way the system works to take advantage of this scarce resource.
So Dennis, we mentioned prevention. Is there anything more than prevention? Like, I mean, when it comes to early detection, what do you think about it?
I think yes, we need to somehow we need to think disruptive, in my opinion. So if we describe the problem or the opportunity that we need to fight future cost of illnesses, then we can't think in silos, right? We need to, as Chris mentioned, and then you can analyze where in the pathway from the people, I don't want to say patients, because maybe we can prevent or early diagnosing. And then you need to show how much return on investment you have, also in terms that you save money along the journey. But this is not a discussion which is taken, right? So if we prevent something and you have less hospitalization, you don't save money. But this must be somehow clear, right? That we point out with evidence, and then the next point is so we need to. There is evidence in hands what it means if we prevent or early diagnostics and off, but there is no willingness to accept it, because usually governments also think in 1 year, and the effect will be in 5, 7, 10 years. You don't know, and you need to measure what is the short-term return on investment, the middle and long-term return on investment, and so this is what matters, and we need to create an understanding. If we invest smart in early diagnostics, early intervention, in prevention, then we save up money in the future, which helps us to get healthier again.
The blending between, let's say, pharmaceutical innovation, but also technological innovation is going to make scientific innovation in the next 10 years progress faster than in the last 50 years. China and US have understood that very well. And Europe, for some reason, is not capitalizing on that. And that's a pity, because we actually have the social net, the social infrastructure, universal healthcare. So we have a competitive advantage versus most of the
So
world.
you think there's still time to do so?
We have to.
In some sectors, they're so far that we
have to. Cell and gene therapy, for example. I mean, it's unparalleled what the offerings are. Yet governments apply cost containment to these innovative therapies just as much as they do to generics. And that to me, or even sometimes more, and that to me is like incomprehensible. How can you actually kill your innovation by treating it as a cost containment basket to go after?
Yeah, I mean, it's both competitiveness, but also strategic autonomy.
Maybe just a comment to this, right?
Sure.
If we really save money due to prevention, then we make our healthcare systems affordable, and we can, with the money we can save, we can invest smart in future innovation. And I want to mention, with innovation, we need to spark innovation in products, processes, and system innovation, right? And then we are not wasting as much money as we do now, and this saves money again, right? So I think there are great opportunities.
You said something about the fact that there's not enough discussion about these topics. Why do you think it's that?
Yeah, first of all, as I started my statement here in this session, in the end, the political decision makers, in the end, they think it's cost.
Yeah.
And that's unfortunately the case, the mindset.
So it's a mindset, yeah.
It's a mindset. If you talk to Minister of Finance around the world, find one Minister of Finance who say, health is a smart investment. In the end, they say, oh, we have budget restrictions. Oh, and the costs in health, they are increasing all the time. Oh, how can we finance it? And I think this is a real problem.
And lack of sense of urgency, like no,
yeah, that you
it'll come. We'll address it when it really becomes acute, and then when it becomes acute, it becomes incredibly expensive.
Yeah. And Calypso, do you agree that there's not enough talking about this debate? You can also say no. I mean,
I think it's the kind of talking there is. I think there is a lot of talking, but it's about being able to bridge the gap and speak the language of ministries of finance and talk about investment, but show why it's an investment. I mean, I know this is perhaps an old statistic that I learned from you, but in Germany, the health sector is a bigger contributor to employment and growth than the automobile industry, and this is Germany, right? So I thought that was a fascinating statistic. So being able to identify this kind of metrics and the potential for other markets and convey that might change the mindset.
I mean, having worked in Germany, and of course, Professor Oswald knows better than me, no system is perfect, but what the German healthcare system has really understood well is they bring innovation immediately to patients, and once a product goes off patent, I mean, the prices drop tremendously. And that creates headroom for innovation, because without innovation, there would not be a generics industry either. And I think that mechanism, that ecosystem, certainly in other countries, is not as well established. So again, that's internal kitchen. That's something that within the industry we should be stronger about, but that's one part that helps well. Again, if I am allowed another example, in my previous role, I was in Singapore, and as a pharmaceutical company, you want to get some economic stimulus from the government. But the Singapore Economic and Finance Body asks you to make a 25-year plan, and you actually have to come and defend that. And we went, we thought it was a plan with investment and all of that, and the Singaporean government said, not good enough, do it again. And you know, that kind of a mindset of thinking that long term was eye-opening to me, and they stick to it. Every 3 years you get a review. Are you doing what you said you would be doing? That is what is lacking here.
Kind of smartness.
Exactly. They keep you focused on that. It's a two-way street, but at least they live up to their commitments as well, and they think that long term. And I miss that here. And I think that's where the EU can play a role above the individual countries.
I was looking, and then he's saying, that's a place, you know, they do this kind of thinking. There's still this aspect of conflicting priorities, because, I mean, budgets are budgets, so they are also restrained. So clearly there's no such a, silver bullet, but I wonder your take of everyone in this panel about how to handle these conflicting priorities in the national budgets, starting with Chris, maybe.
Yeah, first of all, and I already mentioned it, obviously we have our own work to be done. I think the silo budgeting and so on, the inefficiencies that we currently have in the healthcare system, if you can address that, is it 20%, is it a different percentage, that would already make a lot of difference. That is definitely one thing. If you can actually then demonstrate that what you're doing is creating more prosperity, again, it'll be a mechanism that will fuel more taxation and eventually stimulate that as well. But you need to get to that point as well. I think we also need to look at different ways of financing. I mean, Professor Oswald is more of an expert, but can tell you that because it's such a smart investment, there are, let's say, institutions that are willing to invest with local governments, with the EU, and say, look, it's worthwhile to invest here now, and not look at it at the short term, not look at the next year or the next 2-3 years, but look at it, just like in that example in Singapore, for a longer period of time, and maybe reshuffle priorities. We're able to do it with defense now because there's an acute need. Well, we shouldn't have to wait for an acute need to do it, because if there's an acute need, it means we're all in trouble. That means we're in the next pandemic, and I can tell you the next pandemic will be worse than this one then.
And also to Calypso, how to handle these other priorities in budget. What's your take?
I think by integrating health in investment planning more broadly and in a cross-sectoral way, and I'll bring another non-EU example, but I do think it's relevant. Of course, no man or woman is an island, right? And so this is from Nigeria, where the leadership from the president and the Minister of Health, what they're trying to do, and with some degree of success, though it is a long-term journey, is to look at medtech manufacturing end-to-end. I mean, Nigeria is a big market, right? So they're working with the partners in the AU, first of all, to operationalize the free trade union, the African Union, looking to take advantage of the new regulatory agency. It'd be great to have that streamlined regulation to get products through. Looking at investment in R&D, clinical trial infrastructure, so to offer Nigeria as a test bed for testing medicines. And then looking at pulling procurement, both in the country, but then also regionally and beyond, because you need this predictable, sizable, sustained demand in order to get companies to invest. And then getting the likes of DFC, the Development Finance Corporation, the US, or the equivalent EIB and others, to underwrite investments so that companies, private capital comes in and invests and creates jobs. And I think this is the mindset, and it has to be driven at the president's level, right, for that cross-sectoral approach. It can't be bottom-up at the Minister of Health on their own.
Political will.
And I think, this is a space to watch. And again, that's where the potential is the EU to join hands and support and benefit.
Dennis, please use an example that it's in Europe. Not Singapore, not Nigeria. No, I'm joking. But yeah, your thoughts on this, balancing also other priorities. What's your?
I learned in the last 2 decades that we need to see health as a macroeconomic business case, and we need to pitch it at the Ministry of Finance, like you pitched it in Singapore. You need to say, okay, now Minister of Finance, I describe you the business case for your country or for Europe. And then you need to deal with numbers because they are accountant, right? They want to see numbers. And then you say, okay, 10% of GDP is related to health investments, 30 million employees, 8% of the exports. Then if you save up 1% point or 20% of cardiovascular diseases, you get a return of 1% GDP. This makes up X% of your fiscal income of your household. And this discussions need to be done, right? And this top down. And this is something, and then you can also talk, you need to invite not only Minister of Finance, but also Minister of Labor. Because within aging societies, in a lot of European countries, we are facing labor market shortages. If we want to grow, we need to have the capacity. If we are investing now in Europe a lot of money and we don't have the capacities, the human capacities, what happens? Just the prices increase.
Yeah,
So we need to really position health in all policies, for all policies, right? And then another point, you also about the financing, right? There, I think, next to allocating more budgets in health, we need to think about where to allocate given budgets, but third, private-public partnerships, right? And this can be something like health outcome contracts with governments and private capital. That can be social impact bonds. But and then you also need to have this macroeconomic business case so that you have a return on investment.
Maybe Calypso on public-private partnership, because you have a perspective from the WHO, and I don't know your evaluation on this partnership. Are they working?
Well, I mean, we can't do healthcare without the private sector and without private capital. That's the starting point. At the same time, the whole promise of billions to trillions 10 years ago in Addis with the previous Financing for Development conference, that hasn't happened. And so it's not that all blending is wonderful. I think what we do need is government capacity to guide, not to hinder, but to offer that directionality of investment when it comes to concessional financing from the likes of EIB or the World Bank or regional development banks. So you're crowding resources in, but then you mentioned outcomes, right? So you're holding investors to account. You give something back to them, but at the same time, you're not thinking short term, you're thinking longer term. And it is genuinely a partnership. You invite them in, you want to work with them, and it has to be a win-win. So you need the scale, you need clear additionality, not just, I give 5, you give 10, so it's 2 to 1. It's not that. Am I really catalyzing? You need the right target for investment, and you need to generate these longer term economic returns and social returns, because you are the government, you care about people's health and well-being, right? So that's also important. And unfortunately, I think we haven't seen much of that. And to some extent, this is because of lack of capacity and vision and leadership on the part of governments.
Yeah.
So that you wanted to.
Yeah, I wanted to add to what Professor Oswald was saying. If you want a European example, or even two, I mean, I think,
Oh, fine.
for example, Belgium and Switzerland are two countries that, when it comes to healthcare, really are punching above their weight. And I think they understood it, and I think you could see aspects of economy thriving because of that. Now, in the case of Switzerland, and I think that is one of the things that we really lack in Europe, is they have access to venture capital. Switzerland is a pretty good market in venture capital, just like China and US. And I think Europe lost that mainly with the Brexit, where in the UK you had that really venture capital ecosystem. And I don't think anywhere in Europe we have it. I think President von der Leyen has actually seen it as a priority. And I think when we talk about financing for the needs of the future, establishing a venture capital ecosystem is going to be key as well.
Yeah. No, I was in the pre-call for this event with Stine. So
Okay.
we also enjoyed this. So yeah. It's good that actually was brought up.
But to the point of venture capital, I think it's important to have the stewardship as well, because most recently we've seen reports from OECD, from the French Auditor Inspector General, flagging the risks of financialization and commoditization of health. So you need both. You need an environment that regulates, doesn't hinder, but regulates for the common good. Because otherwise you get, that's not about privatization, it's about financialization of the health sector, which actually increases costs, decreases affordability, and hinders quality as well, undermines quality. So there are risks there too.
Now that we mentioned Stina, and she's going back to the parliament to work on the budget. Every time that we deal with budget in Brussels and we deal with health in the EU budget, it's always about whether there's more investments or not. I just want your take, each one in this panel. If it's about to increase the health budget, or it's about to make a better spending of it. So if it's more about a better allocation of resources, or we actually need more money. Maybe we start with Chris.
Yeah, and you know what I'm going to say. It's of course both. I think we have to work on these inefficiencies, but also I think we have to think about different ways of treating it as an investment. And I think the way to go about it with cost containment and clawbacks is not the way to do it. That kills innovation. Instead, you actually have to, and that's my ask to policymakers, is make it like the macroeconomic, let's say, analysis that Professor Oswald was saying. If you create the right stimulus, you create employment, you create prosperity by saying, hey, if we give you a fiscal treatment for a big manufacturing or an R&D investment or whatever it is with healthcare, and you create employment, and the consequences are going to be obviously demonstrated in better health, who cannot be in favor of that?
Maybe some other will not. Calypso, better or more investment?
Yeah, I agree that it has to be both. It depends on the context.
Yeah.
I don't think we can talk on global averages. But one point I would like to make, and it is an issue actually for Europe as well, is out-of-pocket spending and the impact on households of this out-of-pocket spending. And so in terms of outcomes, when you're a policymaker, you want to see how your investment actually reduces this highly inefficient and inequitable source of financing a health system, which is households paying out of pocket. Yeah. And even though the percentage in the EU for high-income countries is around 20% of total spend, in some countries, poorer countries, other regions, we see 70-80%. That's the paradox. The poorer the country, the more the poorest within this country are being asked to pay for health. But even in Europe, for middle-income countries, you see rates of 40-50%, especially in Eastern Europe. And this is a big issue, and it needs addressing, because it's not sustainable, it's inequitable, it's not predictable, and it's not the right kind of financing.
Then it's more or better investment?
It depends on the country.
Okay.
There are a couple of countries where we don't need to invest more.
Like?
Yeah, the big EU5 or in Germany, you can't say that you should invest more than 12%. But just an example for Germany, and this is just why I think it's a macroeconomic business case. Imagine we would have reduced our investment in health by 0.5 percentage points of GDP. then we would be in an even bigger recession.
Yeah.
Because in Germany, it's 1-to-1, 12% investment, health expenditures, investment, creates 12% GDP. If you reduce it, the GDP drops. But honestly, we are wasting money. So but maybe we need to, and this, you need to think about, or every country is unique in a way, but maybe it's important to invest even in Germany, a certain amount to invest in innovation, to restructure, to create return on investment and more efficiency. Because reforms usually not work without an investment. Because everyone needs to feel that he gets an incentive, right? And so maybe, but overall, I would say in some European countries we need to invest more. Eastern Europe, you mentioned Eastern Europe, but yeah, we need to combine both.
And back to Calypso, you also mentioned the health financing reform in some countries. We're moving more to the final part related to the cost of inaction. So what are the social consequences for vulnerable population? You also mentioned just before the impact of out-of-pocket payments, but when it comes to the lack of health financing reforms, or also collapsing aid that you were mentioning, shrinking budget, what are the social consequences based on what you see every day in your daily work?
Well, absolutely, they're significant. I mean, the last year we've got data for about 300 million people were pushed into poverty or extreme poverty because of out-of-pocket spending. The vast majority in Asia and Africa, but a number of people also in Europe. And this is because of the wrong kind of financing, the wrong kind of system, which doesn't protect the most vulnerable. I mean, when we talk about universal coverage, health coverage, really, we're talking about an equalizer, a social equalizer. You take from the wealthy, you give to the poor. You take from the healthy, you give to the sick. And I think that's really important. That's the basis of a functioning economy and a healthy workforce. And the problem with collapsing aid, which is a big deal in many poor countries, I'll give you the case of Malawi, for instance. Just the USAID reduction in funding, the American Development Agency, is costing Malawi about 1 percentage point of its GDP, shrinking because of Forex also. It's not just the direct, it's the fact that they've depleted foreign exchange assets, etc. But also pushing 500,000 people in a country that's already one of the poorest countries in the world, pushing an extra 500,000 people into poverty. So it is important. It's important also because the EU is also an important player and EU member states when it comes to aid. So it shouldn't just be aid, but aid is important, and abrupt changes in aid do cause a lot of suffering.
Just to follow up, I mean, we know everything about the EU in this room. We also know a lot about the WHO, but just for a refresher, what the WHO is doing practically when it comes to prevent the systemic collapse, for instance, when it comes to health financing? Are there specific projects?
So we're not a financing agency, obviously, and we have our own financial challenges, as you will have noticed, might have noticed. But I'll come back to what I've mentioned earlier. So UHCP, partnership with the EU, we offer this platform through our member states, presence in countries. It's not about direct financing, though we support reforms. We offer access to information analytics and hand-holding, supporting countries implement reforms to address, for instance, out-of-pocket payment, to encourage them to pool procurement, to help them make efficiency improvements through strengthening public financial management systems. So this is all thanks to the EU. This is the largest health system strengthening program WHO has. It's funded by the European Union. So that's one thing. And then when it comes to financing, and there we haven't gotten to scale yet, but I think we could do, is through initiatives such as the Health Impact Investment Platform, where you've got the investment plans with government leads, and then you have EIB come in and finance infrastructure in many cases, but infrastructure is wise infrastructure that links to labor, that links to needs, that's geographically well distributed. And I think that's where the EU, and through the Global Gateway and the 150 billion, I understand, the commitment to Africa, can make a huge difference.
And Chris, I'm turning what Dennis said before into a question. Do you think that the health stakeholders or people working in the health bubble are addressing the wrong people, or maybe they should enlarge their audience when it comes to their pitches?
No, I don't think they are addressing the wrong people. And I also have to say that I feel we're having better dialogues, but I still feel there's a lot more to be done. For example, we've been now debating a EU package for a year and a half, and I think it largely ignores the new geopolitical situation, US versus Europe. So the fact that we don't have the flexibility to address that and to course correct and to really
Talking about the pharmaceutical.
mostly, of course.
But also, no, I mean, because
but in general, I think in general, again, because this is also about Europe's competitiveness.
Clearly.
I still feel that talking to the right people, but I keep repeating. I know I sound like a broken record. I don't feel the sense of urgency or the sense of reality, even the sense of reality.
Talking about the sense of urgency, let's create the sense of urgency. So, with concrete examples or prediction about the inaction. So, when lack of investment actually leads to higher costs. You also mentioned something of this before, but what if we don't do this? What's gonna be the future of Europe?
Economically, we will go further down backwards versus US and China. Mm-hmm. That is one thing.
In terms of competitiveness.
And demographic-wise, obviously, there's a huge aging population that is going to be in retirement, not enough active people to support that. So that is one consequence. The other thing is, and there's studies, longevity studies done, and I mentioned that if we don't start spending more on health as a percentage of GDP than we do now, our life expectancy will go down. And that is mind-boggling in the region in the world that is best organized with universal coverage. We have that competitive advantage and we let it slip away. You'll have less education, people become unhealthy because the disease burden only goes up. I mentioned a few of them, so it's a dark picture.
So there's enough, isn't it?
Yeah, it should be. It should be enough, right?
Yeah. And so it's both in terms of societal cost, but also economy. So Draghi wouldn't be happy if this happened.
I don't think he's happy now, but he would even be less happy. Yeah.
Yeah, and coming back to Calypso, so I just want to. I mean, we're mentioning this issue of urgency. Is it something that you actually see? From your perspective, that we really need to act right now. I'm taking advantage of your perspective because you mentioned Nigeria. Like I mentioned, I went to my favorite pizzeria yesterday. So, what's your not prediction, but what's your take on the cost of inaction?
I think this is a critical point. I think we see multilateralism at risk. And I think, when we talk about universal healthcare coverage, when we talk about strengthening public health systems, including in developing countries, we're really talking about a failure of multilateralism, a failure of powers such as the EU to support those core principles, which are a win-win. They're good for health and they're good for the economy. I mean, I don't think we should debate whether health is macro-critical after what happened with COVID. Yeah. This was effectively an economic crisis that was caused by a health crisis. It's obvious. And yet, we see governments now reducing spending on health. Exactly. So it's like COVID never happened. Mm-hmm. So I think we do need the leadership of the EU. We didn't talk about this, but we had the Financing for Development conference in Seville a few weeks ago, where the leaders agreed, the EU was part of that, co-part, agreed to act on debt, agreed to act on scaling up financing by multilateral development banks and blending, and agreed to push for domestic financing, including fairer terms of taxation. So now we need the imagination, the commitment, and the courage of the EU to drive that and make it happen. I've been looking at your documents on the Global Gateway. Team Europe can act on those three pillars, and in the context of that, universal healthcare coverage is a really good buy.
I think many were agreeing when you said it's like COVID never happened in this room. So
how easily we forget.
Yeah, I took some seconds because they actually telling me cut. So we're going going to the conclusions. So we talked a lot about the opportunity strategies, the cost of inaction, but I want each of you to leave final thoughts after our discussion, starting with Dennis. In terms of, I mean, not proximity, the opposite. So Dennis, what's the single most important next step to turn what you were mentioning before, awareness of health's value, into political action based on what we said today?
We need to establish a format in the EU and in the single countries that the Minister of Finance is in discussion with Minister of Economic Affairs and Ministers of Health, so that they have a common understanding, and then the Minister of Finance will understand that poor health in the country means recession. And all countries are highly indebted. If rating agencies would take this into account, then we have the urgency, because bad health is not prosperity, and they are judging prosperity in the future of countries. And so if the ratings, or I formulate it positive, if they are investing smart in health, then they should get an incentive, an upgrade in their rating, and every country could refinance their debts cheaper, and then we create more fiscal space to reinvest in health, and that would be a mechanism. But this is only something you can discuss with ministers of finance, and then you have them as friends.
Your urgency remarks told the show everyone is gonna come back their home and talking about urgency. Calypso, if you could shift one major lever in a financial financing globally, what would it be?
Well, I totally second what you said. I think that's a smart and practical, not easy, but would be really, truly impactful. So my vote for that. And then I would say implement. The EU can implement at scale. We've got the blueprint. When it comes to public health system strengthening, it's there, it works. Scale up, improve, scale up. And if I may, I just have this very quick quote. This is from Ghana's first 5-year development plan, 1951, still under British control, and yet it was the first self-government. And the person who went on to become President Nkrumah, said, health services must be regarded not as a social overhead, but as a vital investment in the productive capacity of our people. This was 75 years ago, and I think we need to honor that commitment.
Wow.
That's vision. Yeah,
that's vision. And Chris, your final thoughts on?
Well, he stole or she stole my thunder, because for me it would really be look at health as an investment, not a cost. Don't treat it and stifle innovation with cost containment, but give it the incentives, because it's a worthwhile investment that gives you multiple returns in many different aspects and leads eventually to overall prosperity. I think it's as simple and as difficult as that.
So these were the key highlights of today's discussion. Thanks for being with us. Also the people who are watching us from one of the camera, I don't know which one. But yeah, thanks for being with us. Stay tuned to Euronews to watch and read all the latest on health and also European broader politics. Thanks again.
Thank you.